some of you are probably a little afraid that they've asked a scientist to speak, because many of my brethren cannot speak English. There's a lot of jargon, and I work pretty hard to try to explain what we do with the support that you raise here with the Lucy Fund and through NFCR. And last year when I was here, or at the other venue, I got to tell about an experiment that we were beginning. It was, well, affectionately known in the lab as the experiment from hell, because it took every person in the lab and volunteers from some other labs. And that one experiment cost us $70,000. But we were testing whether the gene that we had discovered called KISS1, named because it was discovered in Hershey, Pennsylvania. Just so you can think about that one later, you'll love it. The sister gene, we wanted to call HUG1, but the genome people have no sense of humor. But, you know, the matching set of KISS and HUG would have been nice. But KISS1 was discovered as a gene that blocks cancer metastasis. And we were going to do a study to determine whether or not treating some mice with KISS1 would actually reverse metastases, and the timing of that and so on. Well, we did the experiment, and it worked. Not as well as we'd hoped, darn it, but it did work. And that experiment was funded solely from NFCR and you all. And what that experiment might allow us to do in the long term is help patients who are diagnosed with metastatic cancer, render that disease chronic. KISS won't cure patients, but it can keep the metastases from growing, and that's our current goal. Ultimately, I'd like to see all the metastases go away, but that's an achievable goal in the near term. Something I can tell you that we didn't do, but I think you'll find it interesting. It's ironic that the KISS gene makes a protein that's responsible for puberty. Imagine it. Puberty begins with KISS in more ways than one. There are groups around the world, and a clinical trial just completed in Brazil, that you can treat patients with the KISS protein. Which means as soon as we find how the KISS is working in our cancer cells, we may be able to take that information and treat people within weeks, not years. So that's a prelude of things to come. I also wanted to tell you something else that you've helped fund. At KU, sorry, the mosquitoes they're attracted to sweetness. And, we have begun doing some work in our lab with another type of cancer, not just breast cancer, but pancreatic cancer. And those of you who've heard about pancreatic cancer or know someone who's had pancreas cancer know that the time from diagnosis to death is somewhere on average of about 6 to 9 months. It's a really horrible disease. I had a visiting scholar come from Japan, a surgeon, who wanted to learn about metastasis. And we did some studies, and the goal of the study was to identify genes responsible for cancer, pancreatic cancer metastasis. And I am able to report to you, you're the first ones to hear it, that we have found a gene. It's not cleverly named yet because somebody else named it before us, but it's called HMP19. There's a grand total of 1 paper published on this in the entire science world's literature, which means we don't have a clue how it's working. But it blocks pancreatic cancer metastasis, and in our first clinical study that we got the data back from Japan, it actually is able to predict the aggressiveness of pancreatic cancer. And we're just beginning to write that paper. So a big thank you from everybody in our lab. Now, I'll just give you a little bit of a clue, and I don't mean to brag on KU, but I got an okay for you. But I was recruited from Birmingham, Alabama to KU 2.5 years ago. I was asked to build a department of cancer biology. And in April 1st, 2011, an auspicious day to begin a new department, don't you think? April Fool. I arrived, it was a faculty of 1. The department now has 50 people in it, 6 other faculty. And I can't tell this to the people in the department yet because it's not yet released, but thanks to the support from you all, supporting our lab and stuff, we ranked 16th out of public medical schools in cancer biology this year after 2.5 years. And one of the truisms about research is it's not ever done alone. And much like Jalen was saying, one person can do one thing, but it takes a group to do things well. And all of you are a part of every aspect of the research that goes on in our lab, our department, throughout the world, funded through NFCR. How many labs are funded now?
About 38 labs.
Okay, just under 40 labs are funded by NFCR, and it's around the world. And each of you has a part of that. Hold us accountable, all of us researchers. Research is best characterized, are you ready for this? As good days and bad months. We're looking for things that nobody's seen. We make mistakes. But it's a weird group that I'm part of. We want to find things that nobody else has seen before. And the thrill of discovery makes it worthwhile. The thrill of finding something relevant to help people around the world is what we all long for. I thank you from the bottom of my heart. I can tell you everybody in my lab thanks you. And thank you, Lucy, for beginning this. And thank you for letting us partner with you. Thank you so much.